Welcome to our channel, Unlock Anatomy in Seconds. This is our second lecture of our bone anatomy series. So let's discuss our second bone, which is situated in shoulder region, called scapula or shoulder blade. The scapula is a flat, triangular bone that lies on the posterior chest wall between the second and seventh ribs. On its posterior surface, the spine of the scapula projects backward. The lateral end of the spine is free and forms the acromion, which articulates with the clavicle. The superolateral angle of the scapula forms the pear-shaped glenoid cavity, or fossa, which articulates with the head of the humerus at the shoulder joint. The coracoid process projects upward and forward above the glenoid cavity and provides attachment for muscles and ligaments. Medial to the base of the coracoid process is the suprascapular notch. The anterior surface of the scapula is concave and forms the shallow subscapular fossa. The posterior surface of the scapula is divided by the spine into the supraspinous fossa, above, and an infraspinous fossa, below. The inferior angle of the scapula can be palpated easily in the living subject and marks the level of the seventh rib and the spine of the seventh thoracic vertebra. Now let's move on to the angles of scapula. Superior angle is covered by trapezius. Inferior angle is covered by the latissimus dorsi. It moves forwards round the chest when the arm is abducted. Palpation of the inferior angle provides a convenient method for following the movement of the scapula during arm motion. Lateral or glenoid angle is broad and bears the glenoid cavity or fossa, which is directed forward, laterally, and slightly upwards. So these are the muscles which attach on the anterior and posterior side of the scapula. See this diagram closely, and if you have any problems in this, then ask me in comment section. I will make separate videos for muscles, so don't worry. Now we have fractures of scapula. So fractures of the scapula are usually the result of severe trauma, such as occurs in run-over accident victims or in occupants of automobiles involved in crashes. Injuries are usually associated with fractured ribs. Most fractures of the scapula require little treatment because the muscles on the anterior and posterior surfaces adequately splint the fragment. Drop shoulder and wing scapula. The position of the scapula on the posterior wall of the thorax is maintained by the tone and balance of the muscles attached to it. If one of these muscles is paralyzed, the balance is upset, as in drop shoulder, which occurs with paralysis of the trapezius, or wing scapula, caused by paralysis of the serratus anterior. Such imbalance can be detected by careful physical examination. If you like this video, like and subscribe our channel and press the bell icon for more updates. Thank you.